Hey everyone, my name is Lee and I'm a technician at Griffith Small Animal Hospital, and I'm here today to show you a little tutorial on how to administer subcutaneous fluids to your cat. At this point you would have already seen your veterinarian and he would have prescribed subcu fluids for your cat and decided which type of fluids he wants you to use. Today, for the purposes of the tutorial, we'll be using lactated ringers. When you first get your fluids, they will be either set up for you already or they'll come in separate packages. And we're going to go through how to do the setup just in case they're not set up for you by your veterinarian. So what you'll need to get started is the bag of fluids, the IV line or setup, a needle, and once again your veterinarian will decide the appropriate size needle for you, a hanger, and a towel. So let's get started. First off, we want to open the package of the subcu fluids. You should be able to rip into it easily. If not, you can always have a pair of scissors handy to help you. Then we'll open the setup. And the first thing you want to remember about setting up your subcu fluids is to keep everything as clean as possible. It's going to come with a little protective cap on the tip of the line, and all you'll have to do is remove that cap, grab this white piece right here on the base of your bag, pull back, and the whole thing will come off. And once you've removed this protective cover from your line, you just stick that right in there. And it can take a little force to get it all the way in there, but you want to make sure that you have a snug fit in between the bag and the line. The next thing we're going to do is run the fluids all the way through the line. Now the line will come what we call open, which means it's not clamped off in any way, and the fluids will begin to run through the line as soon as you turn the bag upright. This is where it's good to be over a sink or a trash can. Once you're over your sink or trash can, you take the protective cover off of the other end of the line and just wait until you start to see fluid coming through. And you can also check your line for bubbles and make sure that all of the air has come through the line. Once you're done and you see fluid and most of the air is out of the line, you want to take this blue piece right here and roll down until nothing is coming out of the other end of the line. And then to keep everything clean, you recap. Once you have everything set up, you go ahead and twist this bottom part off of your needle, just like that. Take your protective cover off once again and attach your needle to the base of your line. Now a good tip for how to administer the subcu fluids is that gravity is your friend. So if you're in a place where you can use a coat hanger and maybe a kitchen cabinet, and you put your bag of fluids onto your coat hanger, just like this, and then go to a kitchen or a bathroom cabinet, a laundry room cabinet where there's a handle or knob, and you just hang it straight on to that handle or knob. I don't have one in here to show you, so for the purposes of this tutorial, we're just going to use the hook that we would use here at the clinic. Alright, so now we have everything set up. What I'm going to do is go get our patient and we'll be right back and show you how to administer the fluids. See you in a minute. Hey everybody, we're back. This is Kitty Boy. He's my cat and he's going to be our model for the tutorial. And what we're going to do is just go over how to give the injection, how to insert the needle into the skin, where is a good place to give it, and then we'll give some tips and tricks on how to do it successfully in your home. So all you want to do when you first have your cat with you, one of the tricks I like to use is to have food ready. The bowl of food is a good distraction from what you're going to be doing. To get started, I want to show you how to give an injection. And what we usually like to say is to find a place on the cat where there's extra skin, and it's usually around the nape of the neck or the shoulder area. That's usually a good place to start. And what you will do is pull up, see all that extra skin, you'll just pull it up and make a little tent with one hand. And we're going to come in with the needle in the other hand and go parallel to the body and about halfway on the needle. You don't have to worry about putting the needle all the way into the skin. Just make sure that you get it in far enough so that you're not getting any flow back from the IV fluids. Once we're in the skin, we go ahead and unclamp our line. We're going to roll this white wheel up so that the line is fully open, and you can run it as fast as it will go, which is usually pretty quickly. Once again, your veterinarian will decide how much he would like for you to give your cat and how many times a day or how often he would like for you to do it. For the purposes of the tutorial, we're just going to make it quick and easy for Kitty Boy. And so let's get started. So once again, we go to that shoulder area where there's extra skin, and we're going to take our needle that's uncapped and just go right into that skin. Come here, Kitty. And it's okay if they look around. I know some of you at home will probably have your cat fly off the kitchen counter or wherever you're giving it, and that's okay too. This takes practice when doing it at home. So right now I've got that needle tucked under the skin right there, and I'm going to go ahead and open up this line. And you'll see the fluids begin to drop, and he feels it going into his skin, but it shouldn't cause any pain. They do feel a sensation of the fluid running into the skin, but once again, it's not a painful sensation. It shouldn't burn in any way. If they act painful in any way, go ahead and stop your fluids, pull the needle out, and try again. Once again, this takes practice. Alright, so we'll just let it run, and once it's done running, we go ahead and we clamp off this line again. So roll it all the way down. And then what you'll want to do over here is where that needle is in the skin, you'll want to pinch it off with your fingers so that none of the fluid will come out. And then go ahead and just pull your needle straight out like that. Recap your needle. That way you remember every time you go to give your sub-Q fluids that there's a used needle on there, and before you start, you need to change that needle. And then once we're done, go ahead and give your cat a treat. Let him know that he did a good job, and then he'll be more willing to do it the next time. So now I'm going to give you a few tips and tricks. If you have a cat that's not very cooperative, you may have to find a helper. If you do, if you have a nice friend or a nice spouse that's willing to help you, there's another good idea. Why we brought the towel in for the tutorial earlier is you can wrap the towel around the cat, what we like to call a kitty burrito. You take the towel, and what you're really trying to do is make sure that the cat's feet are in the towel so he's not struggling to get away or trying to scratch you. So we're just going to wrap Kitty up here in this towel. And see, he's already getting away, but that's okay. We'll just do it again. So once he's all wrapped and cozy, and you still have the back of the towel right here so you can pull it down a little bit to get where you need to give those fluids, you just pick him up in the towel, or your friend, and come over and sit down in a chair and cradle them in your arms. Some cats find this more comforting than being on a table or a counter. Right, I'm going to go ahead and let Kitty go so we can finish up the end of the tutorial. Thanks, Kitty. One other good tip is to use the Sharpie to mark how much you're giving on the bag. Now if we look at this bag, take it down here for a minute so we can see it better. If you look at the bag, Each space between the numbers, between the 1 and the 2, is 100 mils or cc's. Each middle hash mark marks the 50 cc point. Once again, your veterinarian will decide how much he wants to give you at one time. When you do start administering, it's a good idea to mark the top of the bag, where your fluid line is, where you're starting, and then where you're going to end. And then do that every time so you always know, okay, I need to get to this line and then I'll be done. Another thing that can happen when you first insert the needle into the skin is that you may go all the way through to the other side. Now once you open the line and start running the fluids through, you may see some fluids come out of the skin. If this happens, don't panic. There's two ways you can deal with this. One way is to just pull back gently on the needle so that it's no longer going through the other side of the skin. Open your line back up and make sure that there's no fluids running from the other side. The other thing you can do is close your fluid line completely, remove the needle from the skin, and try again in a different location. One more good tip about where to give the sub-Q fluids is that you want to alternate sites on the cat, which means you don't always want to put the needle in the same location because they can build up a little sore or a little scar tissue right there. So what you can do is anywhere that you see extra skin is go ahead and use any of those areas. So you can use the right shoulder, the left shoulder, mid-shoulder. Sometimes cats will even have a lot of extra skin down here, and it's okay to give it in the hip area. Once again, thanks for watching this tutorial. If there's anything else you would like to see us do, please leave a comment in the comment section below. And let us know what you think of our videos. Thanks again. Bye.
If you have any problems, we're here to, we can show you in our clinic as well, or I don't know.
Okay, I'll just say something and you can edit it. Well, thanks for watching this tutorial today. One of the tricks I like to use is to have food ready, or a little bit of tuna, some treats that they really like. And you can go ahead and place that in front of them to distract them from what you're going to be doing, blah, blah, blah. From what you're going to be doing, I don't know what I'm trying to say. Anyway. And what I usually suggest doing is going ahead and leaving the used needle on until your next dose. Let me fix that. Until your next, what should I say? Dose?
Administration?
Until your next administration. Until the next time you administer? Okay. So what I like to do is go ahead and leave the used, don't say dirty. So what I like to do is go ahead and leave the used needle on the end of your line. Hi,
Hold on.
Oh.
I know it takes time. Okay.
Hi, it's Lee and Kitty Boy again. Just wanted to let you know that this video is not intended to diagnose or treat any animal. If you need, hold on, not intended to diagnose or treat any animal. To get a prescription for subcutaneous fluids, please contact your veterinarian and he will do something.
What about, I mean, Kitty.
Okay, how's that?
Okay.
And then I'll just hold it like that for a second. He's like, what's that?